How do you get better sleep?
So that's a $1,000,000 question. Research does say that we want to sleep within 6 to 8 hour ranges. So am I falling into that category? And then the second dimension that we want to think about is the quality of sleep. How refreshed do I feel after getting a night of sleep? And the third is sleep variability. Do I go to the bed at the same time? Do I fall asleep around the same time? What about my wake time? So that variability is also known to impact your sleep health and how you feel during the daytime. So that's another important indicator. Hi, so I'm Monica Kim. So currently I am conducting some sleep research at Columbia University Medical Center. My specific research topic is on sleep and cognitive aging, along with emotional health. So I'm interested in how sleep health impacts the brain and influences Alzheimer's disease progression or prevention.
When I don't get enough sleep or good sleep, I feel agitated, irritated, and therefore anxious and angry.
Right.
So
Sleep
is that-
is in so many areas, right?
So do you have like a lab at Columbia?
Yes, so we conduct research and it's a clinical research setting. So I also do some clinical work, seeing patients who have insomnia, for example, or sleep difficulties in general. And my clinical goal is to help them individually or in a group setting to obtain better sleep. And research-wise, I'm interested in seeing how those effects on sleep can be transferred to brain health. Because sleep, as you mentioned, can be associated with your brain functioning, but also your emotional functioning. You don't feel good. You feel irritable when you're not getting a good night's sleep. So these are all interconnected.
How do you get better sleep?
So that's a $1,000,000 question. And we can answer that in many, I guess, dimensions. So when we talk about good sleep, we want to think about it first in terms of duration. So are we getting good amount of sleep? So research does say that we want to sleep within 6 to 8 hour ranges. So am I falling into that category? And then the second dimension that we want to think about is the quality of sleep. How refreshed do I feel after getting a night of sleep? How do I feel during the daytime? Do I wake up too many times in the middle of the night? Things like that will determine your sleep quality. And the third is sleep variability. So it's about do I go to the bed at the same time? Do I fall asleep around the same time? What about my wake time? Is that too variable during the weekdays or weekends? So that variability is also known to impact your sleep health and how you feel during the daytime. So that's another important indicator.
So I know as a almost 60-year-old person, I wake up at least 3 times during the night. And I'm not alone, I think, in this.
You're not.
And I'm not sure if I'm getting like a deep sleep or I'm kind of awake because I could hear everything, or I'm dreaming. How can I monitor my sleep?
Yeah, that's a really good question. So in terms of waking up, like there is a myth that I want to debunk first is that when I wake up in the middle of the night, that's bad. That's how a lot of people perceive that. But the truth is, even a good sleeper, like good sleepers overall, do wake up many times throughout the night. So on average, we wake up around 10 times a night. We just don't remember that, or we're not aware of that.
Okay.
Problem is when you do wake up in the middle of the night and have difficulty falling back to sleep. So let's say someone can come to me and say, I wake up 3 times a night, just like you said. Then my first question back to you would be, well, are you able to fall asleep right away? And what is your answer to that question?
Yes.
Yes. Then I wouldn't really worry about it because you
okay.
are waking up. And if you are able to fall back asleep, we don't really consider that a problem because it's if your wake time in the middle of the night is prolonged for 30 minutes or more, then we would consider that like an insomnia symptom. But if it's not, then we're not really concerned about it. And also my follow-up question would be, what wakes you up in the middle of the night? Do you know or do you not know the source? You don't have to answer that if you don't want to, but
Oh, I do. I need to go to the bathroom.
You need to use the bathroom. So that's a very common one too. So then, I mean, we can proactively plan for then, can I reduce my liquid intake before bedtime so that I don't have to use the bathroom so frequently in the middle of the night? You know, we can like act around or intervene that way. For some people, it could be an unknown factor. It could be sleep apnea, which is also very common, especially with the aging process. And it could be like, no, my dog wakes me up, my husband, my bed partner, noises from the street. You know, it could be a lot of things. So once we know the source, we can intervene. But I think the bigger problem is if you're having difficulty falling back asleep, it could lead to sleep anxiety, like, ugh, why am I not falling back asleep? And then that could worsen your sleep symptoms afterwards too.
So what do you do when you cannot go back to sleep or fall back to sleep?
Yeah. So one thing that I really try to emphasize in sleep health, and if you could get over this, you can get over a lot of psychological sleep problems,
Oh,
is
okay.
to not be afraid of being awake in the middle of the night. And don't put in so much effort. So we call this sleep effort if you are trying hard to fall back asleep. And it's very unproductive because if you think about when our body falls asleep, it's the opposite of being nervous or aroused, right? So if your body is detecting any type of threat or if it has some worries, then it's going to be more difficult for you to fall asleep. But let's say you wake up in the middle of the night and you're worrying, I need to fall back asleep. I have this tomorrow. I have that tomorrow. I should be sleeping right now. Why am I awake? Well, that will increase your level of anxiety, which is going to wake up your brain and your body, and then you're going to have a harder time falling asleep. Right? So a more productive and a more effective way is to think, oh, I'm not falling asleep. It's not in my control. Might as well get out and enjoy this time, and I'll come back to bed when I'm feeling sleepy again. So my go-to is, you know, just get out of bed if you feel like you're not falling asleep readily and do something that's fun. Like I would say moderately fun because you don't want it to be too fun and exciting and your sleep will run away. But I have like a list of books or I have a stack of books or magazines are good ones because you can just kind of mindlessly like see the pictures and flip through them. You can listen to podcasts such as this.
That's right.
Or like puzzle or knitting or whatever it could be. And for example, if someone comes to me and asks me, can I watch TV? Can I go on my phone? Those are screens. And then, you know, I hear that screens are not good for your sleep. Well, it depends. So if you feel like you being on screen has a function of reducing your anxiety, then I think it could be helpful too. So I say, then go ahead. But just be mindful of how your body is reacting to these different stimuli. So I would start with some of the calmer, like reading magazines or knitting or things like that, and try out different things that could kind of healthily distract you from sleep effort and sleep anxiety.
New concept that you said, don't be afraid of not falling
Don't be
back.
afraid.
That's really great.
For example, for me too, sometimes I don't get a perfect night of sleep and I'm a sleep researcher. And, you know, so many things can impact our sleep. Daily stressors or hormonal changes, the weather, the environment, a lot of different things. So when you do wake up, you can't really force a sleep to come.
Right.
Sleep is something that comes to you. It happens to your body and to your mind. So if you try to force it to come, you're going to become more obsessed around it. And obsession brings anxiety, and anxiety brings more arousal and wakefulness.
Right.
So it's just better to just accept that you're not sleeping. Well, it's not coming to me. So I could engage in something else until it does come to me.
It could be days, right? Until
Yeah, I
you
mean,
find something that works for you.
I mean, it might just be a good idea to have a general sense of what you can do, like plan forward, because we know that at some point we don't always have a good night's sleep. So just have a list of books that you want to read. We always don't have a lot of time to read. So that's a perfect time to catch up on your reading. So it might take days, as you said, to find what could really work for you. But in terms of sleep, the funny thing about sleep too is that you can't go too long without sleep. So if you got a bad night of sleep, the chances are your sleep drive will build up for next day. So it'll be easier for you to fall asleep the following day. Yeah, even my patients with the, worst insomnia symptoms, they cannot maintain not sleeping for days because our body is just not designed to live without sleep. So trust your body, trust that your body will eventually fall asleep when there is enough sleep drive and when the time is right.
So don't force it.
Don't force it.
Yeah.
It's just unproductive.
That's so interesting. So maybe I should have asked this in the beginning, but what is the objective of your research?
The objective of my research is to improve sleep and make sleep treatments more accessible to people. So I do engage in different clinical trials to make sleep treatments easier to access to different populations, including Korean Americans and older adults, and to see how that can influence not just their sleep and just functioning around sleep, but also their cognitive abilities, the Alzheimer's disease biomarkers, so like proteins that could lead to Alzheimer's disease symptoms, and can improving sleep also reduce some of the depressive symptoms or suicidal thoughts. So my saying, that is to all say that I'm trying to see sleep as a gateway to different parts of health overall.
So would maybe one day sleep, would be a prescription to anxiety, depression, Alzheimer's, or whatever cognitive symptoms?
Yeah, so it is already unofficially a universally given prescription for a lot of different psychiatric conditions, or even just for health. Like if someone went through a major surgery or a cancer treatment, then it's not uncommon to hear, well, make sure on top of all the treatments that you're going through, get some good rest and get a good night's sleep. It's not uncommon to hear that. So it
That's
is
true.
already being prescribed as sort of an add-on treatment for a lot of different conditions. My goal, though, as you said, is to make it more official and have it be on the mind of patients and clinicians more, I guess, on like as a priority. Even in Alzheimer's field, like we now know that sleep is so strongly associated with Alzheimer's disease risks. But assessing sleep or implementing sleep treatments within the Alzheimer's care setting is not very strong. It isn't as established as us sleep researchers would like. So we want to highlight that more in the clinical setting. And there's still so much to learn about sleep in different populations, how culture influences sleep. So we are also trying to study sleep in diverse populations. And me, in particular, I'm interested in Korean American sleep and how to get more Korean Americans and older adults in particular to get into sleep care settings so they can benefit the most out of it.
That's interesting. The doctors have recommended, like, what about sleep monitoring? What do you call that? The monitoring center or sleep center to see.
Yes.
And every time I'm like, I don't know. Okay. I've never been to one, but is it important?
It depends on what kinds of symptoms you are noticing. So to be diagnosed with insomnia, you don't necessarily need objective monitoring or assessments. So diagnosis of insomnia is done through self-reports, how your sleep is, what your perceived sleep is like, and how tired you feel or how interfering your day-to-day functioning is. But if you feel like you have something other than that, so So for example, I've mentioned sleep apnea because
Yeah.
it's another very common sleep disorder.
Right.
So for example, to be diagnosed with sleep apnea, you would need an objective measure to determine, so we call this index. So depending on what kind of level you lie on that index, it's called apnea hypoxia index. You get diagnosed with different levels of apnea.
So to
So
first
in
tell us what sleep apnea is.
Yes, so sleep apnea is this condition where your airway is blocked during sleep. So it's different from snoring because snoring is just like making some sounds because there's a bit of a blockage. But apnea is there is almost complete or more prolonged state of blockage. So a common sound that you hear with somebody who has apnea is like something like like blockage of air, and then like waking up in the middle of it because your body is just like really needing that oxygen. So your body wakes you up in the middle of the night. So, and snoring is a good indicator to determine like if it's bad snoring plus the obstruction sound that determines, that gives some signs as to like whether this person has apnea or no. But in order to really determine the level of apnea, whether it's a clinical level or if it's like mild or, minimal, then you have to go through some type of assessment, like an objective assessment process. For that, a lot of people would, the doctors or clinicians would require sleep clinic based monitoring, or nowadays things are much better. There are these portable devices. So the gold standard to be diagnosed with sleep apnea is polysomnography, PSG for short. So that's where you have all these like electrodes stuck and then different parts of your body, and it measures all aspects of your sleep, how your brain is functioning, how the oxygen is coming in. So like full PSG used to be done in sleep clinics, but now they're portable ones that the clinics will be sending out to your house. So you follow the instructions on how to do that and return the devices. So it could be done that way too.
Oh, okay. I might look into that.
Yeah. And there are other types of sleep disorders, like some of the, while we're talking about other sleep disorders, like restless leg syndrome is this involuntary movement of your leg. And then that would also require, we also want to rule out any other types of sleep disorders. So that's why, if you're detecting that something is not right with your sleep, it is always a good, I guess, decision to find a sleep clinic. They may ask or not ask for you to go through a full night of PSG because, for example, if they think that it's only insomnia, then maybe you might not need a full PSG. But if they detect or if they suspect that, there might be some other things going on, then they might require a full PSG.
Interesting. What happens if you go prolonged period of time not being treated for instance, sleep apnea?
And in terms of performance level or cognitive performance, it could be really impaired if you have this untreated sleep disorder because your thinking could be impaired with non-restorative sleep or having a sleep disorder in general. And if you cannot think, of course, your performance will be decreased and that could negatively impact your overall just work setting, your career development, or depending on what you're doing, just daytime impairment. Mood impairment, as I mentioned, like irritability, you're more likely to feel depressed or anxious, feeling like you're on edge all the time. So these are very common sequelae of getting bad night sleep. And if they're prolonged, it's not just about the surface level like sleepiness or cognitive, lapses, but it could really get to your core health. Like it's associated with some of chronic conditions like hypertension, diabetes. It could really tackle your immune system. Like it's also associated with cancer development. It could be a lot of different parts of the brain. So, and as I mentioned, it could be associated with some of the proteins and neurotoxins associated with Alzheimer's disease. So we definitely want to be very proactive about noticing what's happening with my sleep, with my daytime functioning, and how long that's been going on. So, for example, the definition of it, chronic insomnia, is a duration of 3 months or more.
Wow. Oh, wow. Well, it's almost like sleep is such a, like eating and, going to the bathroom is such a basic and obvious part of our lives. We don't really pay attention that much. We don't really like proactively do anything about it. But what you're saying is it's just like umbrella, biological, psychological, emotional, all of our being.
All encompassing
Yeah.
phenomenon, right? Yes. So that is an important point to make because if you think about it, we spend about 1/3 of our lives sleeping. If you're thinking that you're getting about 8 hours of sleep. Yeah, so it's forgotten easily, as you mentioned, kind of like eating. We don't always pay attention to what we're eating, what's on our plate. But just like sleep, we don't really actively think about it until something goes wrong. And there are pros and cons about that. Okay, so the benefit of not thinking about sleep too much is that this is how I view sleep health. Like, I know that some people become overly focused on how good their sleep is. They would try to track their sleep using wearables, and they're always monitoring how many deep sleep and how many hours they're getting. Well, as I mentioned, that could lead to sleep anxiety and sleep obsession. Some people who have good sleep but still track their sleep using their wearables, and when they're noticing my sleep isn't as good as I thought, then they develop what is called orthosomnia, which means it's kind of like fake, kind of added on insomnia, like unnecessary insomnia. But we also have to really remember that sleep is all very subjective. That's why insomnia diagnosis is based on self-report. So I don't want people to over-focus on sleep. Meanwhile, the disadvantage of not thinking about sleep could be that you could easily dismiss, like, oh, that was just snoring. Oh, I don't really need, I can survive on 4 hours of sleep. That kind of mindset can be also dangerous because when that is prolonged, as I mentioned, it could impact different parts of your body. And I always say poor or insufficient sleep will somehow come out of your bodies in some way, like in terms of cognitive performance, in terms of sickness, malaise, bad mood, or, it will find its outlet. So it's important to maintain that balance of not going too overboard with worrying so much about your sleep or just not caring about your sleep at all. So that's an important balance to maintain. And it's just about, well, how's it going? And just like quickly checking, and you will know when your sleep's not going well. And I think that's when you can start thinking about what needs to be done to prevent this acute problem, from becoming a long-term chronic problem. But acute problems are not that detrimental. It's not too bad. So if you feel like you're getting a good night's sleep now, then I tell them, well, just good night's sleep is okay. Like, you don't need to like improve it so that your deep sleep is like, so yeah, exactly. There is no perfect sleep. You don't need a perfect sleep. You just need a good enough sleep.
Good enough. Okay. That's always the key word, right? Good enough.
Yes, yeah, because we don't want to be obsessed. Yeah.
Okay, first let me ask you, because I was like, when you mentioned a Korean American sleep pattern, what is that? What do we look like?
Korean Americans, I think in a lot of cases, especially with like psychological conditions, Korean Americans tend to follow their root of origin. So what sleep is like, what depression, suicidal trends are like in Korea, is being followed by Korean Americans in many cases. So I see some similarities between just mainland Korea and Koreans in Korea and Korean Americans. So this high value of working hard, working more, less sleep. That is just the similarity just across all Korean cultures overall. So compared to the general populations, Korean Americans may work harder, get less sleep, or have less emphasis on good sleep. That trend may be changing with the changing generations and more information about the importance of sleep. But what I'm more concerned about in terms of Korean Americans is that disconnect from the mainstream healthcare. So Koreans in Korea, or for example, the general population or English-speaking populations in the US have an easier time finding healthcare providers, which leads them to be more active about seeking treatment and diagnosis. Korean Americans, especially those who are not very fluent in English, may have a harder time seeking a provider who speaks Korean, who understands the Korean culture, and therefore many people would hesitate going into the clinics to be evaluated. That's not just a sleep health problem, but I see that as a general psychiatric health problem.
Right.
Yeah. So for example, sleep treatment, like treatment for insomnia, the gold standard right now is cognitive behavioral therapy for insomnia. CBTI is a gold standard for insomnia treatment currently. But a lot of people, first, there's low literacy around it. Not very many people know about CBTI in the Korean American community. There's not a lot of providers who can do CBTI. There's a language barrier, and there are not a lot of like clinics, and people's awareness and openness to accessing these type of treatment is really a problem. So that's why I want to develop a problem that can target Korean Americans in a more scalable way, because doing one-on-one, what I'm realizing is not enough. There are not many CBTI providers who are Koreans and can speak Korean language. And there are just so many Korean Americans who need help around their sleep problems. So my goal, I'm applying for grants to make this happen, is to develop more of a group-based, community-based interventions where more people can get treatments they need. So that's just generally more of an intervention problem.
Wow. So I am a Korean American. I'm in my midlife or late midlife. I don't even know. And most of my friends are, in their late 50s or 60s. Korean Americans doing pretty well in their social economical settings, right? Many of us talk about, oh my gosh, I just can't sleep. Maybe it's coffee. Maybe it's, I'm, anxious about my kids, or I'm not exercising enough, or maybe it's depression symptoms. Maybe it's genetics. So we talk about these things, but we don't really have an understanding of what it is, what we could do about it, and why we need to do something about it. Can you explain those things for us?
Yeah, so let's get the first thing. So what is causing this? And as you mentioned, it could be a combination of all of those factors that you just mentioned. If it could be genetic inheritability for sure. If you have a family history of poor sleep, then you're at a higher vulnerability of developing a sleep problem or disorder. So yes, that could be a factor. And with the aging process, it's very normal for your sleep to change. Actually, I just tell everybody to expect that your sleep will change with the aging process. So some of the common changes that you can expect is that your circadian rhythm, so your 24-hour bodily rhythm in terms of wakefulness and sleepiness, that will change with aging. So it's, we hear our grandmas, saying like, oh, I can't stay up too late anymore, and then they fall
Right.
asleep at 8 and wake up at 4. So that's because their 24-hour rhythm, the circadian rhythm, gets advanced to an earlier time.
So it's normal. It's to be
So
expected.
it's normal.
Yeah,
Yes.
okay.
So that's very normal. A second normal change is there's reduction of what we call slow wave sleep. Slow wave sleep is a deep sleep stage that we hear about in the popular media, and we need that for memory consolidation, clearing these Alzheimer's disease risk, related proteins and all of the restorative functions of the brain. And with aging, that percentage of slow wave sleep decreases throughout with the aging process. So it's normal that an older adult will spend more time in the lighter sleep stages, which makes them wake up more easily with an external sound or interruptions.
Okay.
Versus while in the deeper stages of sleep, then your sleep will be less fragmented. So when somebody says, when an 할머니 says like, oh, I wake up so many times over the night, well, that's also, that could also be part of a normal aging process. So there are different things that, we kind of accept in the field as a normal change associated with aging.
Okay.
So that could be also that. And for women too, menopause is also a big factor that could really change sleep cycles. The symptoms, the hot flashes, and, the bodily and symptoms that's associated with, that could really interrupt your sleep.
Yeah.
It could be stressors, and stressors are present at all age groups. College students have final exams, the people who go to, have jobs, have like job related stressors. Everybody does, like family stressors and relationships, everybody does that. So that's not specific to an older age, but the nature of your worries just change. And another important factor is just overall changes in your day-to-day schedule. Retirement is common in an older age. So you kind of lose that structure you used to have while you were working. So what I tell people who are entering the aging population or the late life stage is to say, well, even when you're not working, actively seek out things to structure your days or schedule things in your calendar so you are following that schedule. Let's say if you don't have anything throughout the day and you're in front of the TV all day, just watching TV, not doing anything, it's easier to fall asleep, and that will interrupt your sleep cycle. And you need some movement and exercise in order for you to feel tired at nighttime. But if you're not moving around, you're not going to accumulate that sleep drive as much as somebody who does exercise and move their body during the daytime. So I think all of these become very important. Make sure to go outside, see some morning sunlight, engage in some social activities and cognitive activities. Keep yourself busy. And just enter bed when you are ready to fall asleep. Stay out of bed if you're not going to be sleeping. Some people just, when there's that absence of schedule, may just spend a lot of time in bed watching TV, and their sleep cycle just gets interrupted. They nap and on and off and not moving. So all of those could be some important factors. So it's important to keep those in mind and design your day. I always say that sleep work starts in the daytime. Sleep work is not just for nighttime. So plan ahead, think about what you want to do in the daytime so that you can increase the chance of sleep coming to you at nighttime. You can't force it to come to you, but you can definitely set up things so that it can come more readily to you.
I like that. It comes to you. Never thought about it that way. It was almost like, oh, it's time. Let's go to bed. I can't fall asleep.
Right. Yeah, exactly.
Oh, okay.
So a paradox that I've been seeing in this modern society is that we put on sleep aids, we put on melatonin to fall asleep. When we wake up, we drink coffee to fight sleep. So we almost want to kind of like manipulate our, body and our sleep cycle.
Yeah.
And it just doesn't work that way. That's that's a very big sign that we're trying to control our sleep. And that's the opposite of what I would want for, as a sleep health provider. Just let your body follow the natural cycle and you just support it to happen with, some scheduling and designing.
Yeah. Is it healthy to take a nap?
Also a very good question. So it depends. Yes and no. So
Okay.
it very much depends on what time of the day you're taking a nap and how long you're taking your nap. So some golden rules that I would mention is the earlier in the daytime is better. So for example, like sometime in the late morning, early afternoon may be okay, but don't let it go too late into the afternoon or the evening time because we want our body to have enough depth to our body, like sleep depth to our body. And when it gets accumulated, that's when our body's like, all right, I need sleep. Let's fall asleep. That's when sleep comes to us. But if we eat up that sleep debt earlier or later into the afternoon, then it'll be harder for you to accumulate the debt later in the evening time. So it's better to do it earlier in the daytime. And the amount is also very important. I say power nap is the best because if you take a long nap, again, you will pay that debt quite a lot. Then you won't have so much at the end of the night.
Right.
So power nap, what I mean by that is I think 10 to 15 minutes is that sweet spot of that. And, people come back to me and say like, what can 10 minutes do to me? A lot of things actually, because your brain doesn't quite enter the deep stage of sleep. So you get the benefit of some light sleep stages, which is restoration, without it really eating up a lot of your sleep debt. And you feel more invigorated after coming out of it. So when I take a nap, I love taking naps, like siestas, like what people in Spain do. I set up an alarm. So when you're planning on taking a nap, setting an alarm is the key. Okay. So I would usually set up an alarm for 30 minutes, giving some time to fall asleep, and then it won't go over like 25 minutes or 20 minutes. So I just give myself very little time, get into it, get out quickly, feel better without impacting my nighttime sleep.
Yeah. Yeah, I know. The power naps are great. I take 10-minute naps. Sometimes it's just like you wake up refreshed.
Exactly.
Yeah,
You're just like a different version.
Exactly. It's like, oh, okay. Wide awake. But I think I get pretty good night's sleep. I don't think I sleep very deeply, but like sometimes I feel so tired during the day. I just like, is that okay? Am I okay?
So I would differentiate tiredness and sleepiness. So
Oh,
that's a very important distinction to
okay.
make because a lot of people confuse the two
Yeah.
and try to sleep when they don't need it. So
Huh.
feeling tired or fatigued is a state of low energy. And you can feel tired from a lot of different factors. Dehydration, maybe you've worked your body too much. It could be sleep. It could be like mood. When you're feeling depressed, you don't have a lot of energy. So it could be a lot of different things. On the other hand, sleepiness comes from a lack of sleep. So when you're not sleeping enough or when your sleep has been interrupted, and sleepiness is that feeling of your eyelids coming down, like feeling really heavy, and you feel like you can fall asleep any moment. But you need to
Okay.
distinguish the two because the solution to tiredness and fatigue is not sleep. That is moving around more, drinking water, eating, exercising. It could be, different solution based on the source of it. The
Huh.
solution to sleepiness is sleeping.
Okay.
And even in the middle of the night, I know so many of my patients would be like, Monica, I'm very tired, but I can't fall asleep. And my question would be, are you tired or are you sleepy? Because if you're just tired, that tiredness doesn't tell me that your sleep is coming to you. If you have sleepiness, that's a big indicator that your sleep is on its way to you.
Huh.
So
Okay.
yeah, but going back to your question, you could be sleeping well, but you still feel tired during the daytime. So I would try to first differentiate the two to
Okay.
try to determine whether you're tired or whether you're about to fall asleep. And if it's a latter case, if it's that, I am still very sleepy. I got a good night's sleep yesterday. Well, it could be just changes in circadian rhythm because the thing about our circadian rhythm is that it goes up in the morning, like our wakefulness goes up in the morning because we just paid off our debt, right? But naturally, we have this dip in the afternoon. It goes like dip and then goes up and dip again. At nighttime, that's when sleep comes. But that mid-afternoon dip, that's when we go for a
3
coffee
p.m.
break, right?
Yeah.
Exactly. So it could just be your circadian rhythm. So, you can easily like maybe try to wake yourself up so you don't take a, long nap in the middle of the day. Or just try to engage in something more active to fight it off if you feel like you've gotten sufficient amount of sleep.
Yeah.
It could be just that out of boredom. It could be out of, other things too. But if you're feeling tired to the level where it's really impairing your day-to-day functioning, then, you can suspect some type of sleep disorder or sleep apnea, for example, because your sleep quality is so low and your body wakes up multiple times throughout the day that even if you're in bed for, let's say, 8 or 9 hours, the actual good quality sleep may be very short. And that may be causing some daytime sleepiness. So that's when I say, you're still feeling sleepy during the daytime, despite being in bed for 8 hours. Do you wake up in the middle of the night? Do you have sleep apnea? Those are some of the questions that I would ask. And it is also a new phenomenon too, that we're now discovering that there's this group of people who are getting non-restorative sleep. It's a separate category. So even if they're getting good night of sleep, they're just feeling sleepy. So the best thing, if it's becoming more severe, is that to seek some clinical help at a sleep clinic to rule out any other sleep disorders or to see what may be the best course of treatment.
So my husband pops those melatonins like candy every night. And he's like, oh, it's natural. It is natural, right? What do you think? Do you recommend it or no?
Yeah, so this is a common topic that comes up. It is still controversial even within the sleep field. As an insomnia treatment provider and a sleep researcher, I don't think it's the best option we have. So first, my question would be, why? Why would you need to take melatonin? What do you think will happen if you don't take melatonin? And the common response, I'm gonna pretend it's not your husband. I'm gonna pretend it's just like a common response. And they're saying, because I can't fall asleep naturally. I don't. My body just forgot how to do that. Then I'll go through like a whole set of questions to determine insomnia. And if it is insomnia, so first of all, melatonin is not a sleep aid. It's not a sleep medication. A lot of people think that once you take melatonin, it makes the sleep come, kind of like forcing sleep to come. But melatonin is actually a start signal for your brain to start the sleep process going. So it's almost like if you're running a track, a lot of people think that melatonin can give you that energy to run faster. But it's more like melatonin is that 1, 2, go, like the go signal, like yoi tang, that signal. So that melatonin becomes a sign for the body to fall asleep. Is it natural? Yes. Well, it is mimicking a hormone in our body. Is it safe? Relatively, yes, but we just don't know what kind of long-term impact it will have. And as a psychologist who treats insomnia, it's not the best option because you become more dependent on an extra source for your sleep. while you have this ability to fall asleep. Yeah, because your body always has the ability to fall asleep. It always has since you were born, since you were, forever of the human history. But it's just that there are other factors that get in the way of you falling asleep. So the question would be then, well, then how can we remove those factors that, that become barriers to your sleep. And that's what cognitive behavioral therapy for insomnia is. What are some of the maladaptive, unhelpful thinkings and behaviors around sleep that you have now? And if you remove those and replace with healthier thinking style and healthier behaviors, then you're enhancing, you're empowering your body to regain that sleep ability. And just a couple of things that I don't like about melatonin is that first, some people, a lot of companies advertise saying there's no, you don't become like dependent on it. Like your body doesn't develop, tolerance and, it doesn't have the same effect of some of the prescribed sedatives or hypnotics. Well, you become psychologically dependent on it. So you will kind of always need to take something to fall asleep. And when you don't have it, that's when a lot of sleep anxiety will come. I need this in order to fall asleep. But if I don't have this, means threat, alarm. So that's going to be sleep anxiety.
Yeah.
So I don't like that psychological dependence, and it just worsens your insomnia symptoms. Secondly, there was this large-scale study that looked at all these different ingredients within melatonin pills that are being sold in the US. I don't know how it is in the Korean market, but a lot of the melatonin brands that were sold here had not just melatonin. It had other ingredients that were sort of not related to melatonin, some random ingredients that we didn't really expect. And in some cases, the dosages that they mention, for example, they would say 3 milligrams or one, and the dosages were different. They were significantly more, for example, than we might have thought. And the problem with that is melatonin impacts the system. It doesn't just impact the sleep wake cycle. It impacts because it's a hormone, it impacts your overall network of bodily functions. So changing melatonin system could mean changing the other system, and it changes the circadian rhythm because you're giving start signals at different times. So I'm more concerned about, well, we don't know the long-term consequences yet, but is it going to be really as safe as we believe it is if you're trying to change kind of other parts of the body? So I only use melatonin for jet lag or for patients who have circadian rhythm disorders. So for example, people who have really delayed sleep time, so their circadian rhythm is misaligned with the societal rhythm, then I need to call it back up, come so that it's closely aligned with the societal rhythm. Then that's when we need the signal for the sleep to start. So that's when I would say, melatonin could be helpful. When I travel to Korea, when I come back, and if I have a hard time adjusting, then for jet lag, I would take maybe 1 milligrams. It's not even necessary, but sometimes I do. But taking melatonin every night because of fear of not falling asleep, I think there could be definitely other better options. Sorry, let me just add on a little bit to what I said before. So for people who are taking melatonins, and I mentioned there may be other better options. Yes, with one being CBT for insomnia, and it could be short-term, medication. So sleep, I think a lot of people are very hesitant to initiate sleep medications because of side effects or just bad reputation. But they could be very helpful if it's taken, over a short term, and you can just, get out of insomnia quickly too. So it's always just best to talk to your provider.
Yeah, what can we do at home that, would be helpful?
Yeah, so for sleep health, I try to think about them in different steps or stages. So first, here are some things that you can do at home. So I've already mentioned some of them. Let's say, So getting out of bed when you're not sleeping, because I don't want anybody to develop sleep anxiety. Sleep is supposed to be this very relaxing, very enjoyable moment. You're giving yourself some rest after a long day of working hard in your role. So sleep should be viewed as something that's very pleasant. But if you're developing sleep anxiety and worried about not going to sleep readily, then we want to work on that first, right? So when you're not sleeping, maybe when you're not falling asleep within 15 and 20 minutes, and without looking at the clock, I don't want anybody to look at the clock because it increases sleep anxiety. Then getting out of bed, just be cool about it. Like, sleep is not coming to me yet. It will some other time. Do something that's enjoyable, and go back to bed when you feel like sleep is coming. Your eyelids are closing and you feel like you can enter sleep. So that's one important thing. And keeping bed for sleep only, because, and I say sleep and sex only, because bed should be associated with sleep. Because at the side of bed, we want it to be associated with sleep. So your body naturally helps you enter the sleep stages, like sleep states. But if you play video games in bed, if you're watching shorts in bed, now bed is becoming associated as a place to play, to be active, to be stimulated. And so our body will not naturally respond to the side of bed. Consistency and routine is really important too. So trying to go to bed around the same time, trying to wake up around the same time, it helps strengthen your circadian rhythm. So remember, your brain is in this dark room called the skull. It doesn't know whether it's time to sleep or whether it's time to be awake. You have to feed that information by strengthening your circadian rhythm, by light exposures, these different things. So make sure that you get some morning sunlight to strengthen your morning rhythm. And then nighttime, you also want to tell your brain that, hey, it's getting dark, it's nighttime, it's time to go to sleep soon, by making, your room more dim and just turn off a lot of bright lights. That way your body kind of naturally understands, and your brain understands that, oh, it must be getting dark. I'm not getting a lot of light input through the eyes. So those are just a few of the things, like, eating at regular times, exercising, and moving your body during the daytime so you feel, tired and sleepy enough to fall asleep. Avoiding late, long naps. These are the types of things that we can try in those first stages. So identify what is interfering with your sleep. If it's a sound from outside, then you might want to get a white noise. If it's the light that's coming in through the window way too early in the morning, then you might want to get a blackout curtain. If it's your bedtime partner who keeps on waking you up, then it's okay to have some time separate to sleep in separate rooms. In our field, we call this sleep divorce, and we think it's a good idea for couples who are not good at sleeping next to each other. So once you're able to tackle these stage one sort of behaviors and environments, and if it's still not working, then you do want to move on to an actual CBTI protocol so that somebody can track your sleep, monitor your symptoms, and work with you to progress through the intervention.
I see.
So I always say, well, don't rely too much on, who says what and, what the ChatGPT says, because you may need more personalized treatment depending on what you're experiencing. And especially for some people, for busy young people who say, I don't need that much sleep. Like, I have so many things to do, so sleep is my low priority. Then it will show up in one way or another in the future. Your brain, your body remembers. It will kind of accumulate all of these negative impacts of lack of or poor sleep, and it will show up later. And that's what I fear will happen to some people who are especially at higher risk of developing other conditions, because that poor sleep can really make it go beyond that threshold. and increase the risk of you actually developing some of the health conditions.
I've learned so much today about good sleep or getting good sleep. And also, I like that some of those things are normal and to be expected with my aging.
Yes.
So I'm not so concerned or overly obsessed with, oh my gosh, what's going to happen to me? So, Dr. Kim, if you had to say one thing that would be helpful for aging adults, Korean American or not, what would that be?
Don't expect that your sleep will be good all the time. You know, sleep changes with aging. Sleep changes with so many things. When you're noticing that your sleep is regressing or is just getting worse, just monitor it. Some may be natural, but what if it comes to the point where it's really impacting your day-to-day functioning? Don't be shy. Don't be afraid to seek help, because many times the help will be very reachable, very accessible. And CBTI is only 6 to 8 sessions, meaning it's about a 2-month treatment. So imagine you can modify your sleep in 2 months. You know, you may find out that some of these problems can be gone sooner than you think. So be proactive about that.
Yeah, I realized that sleep is one of those areas we need to pay attention.
It could be a key to a lot of things.
Very good. Thank you so much, Dr. Kim, for your time and
Thank you.
informing us with this very important topic today.
Yeah.